Does any of this apply to um, non-longitudinal relationships that aren't telehealth? People also go to emergency clinics, minute clinics, and so on. Is it the same concepts apply?
I think so. And we created this hierarchy of types of visits where we thought continuity would be more prevalent or important. And those were kind of the urgent care, the emergency department were kind of next up on the list, where you really don't necessarily expect those to be starting longitudinal relationships. Although I do know some family practices that started as urgent care centers still provide that, but then when people develop a relationship, then they actually start developing continuity practices. So you can have that certainly some in urgent care, but those are really expected to be one-off visits. I think those are better visits, even if we recognize we're not developing a long-term relationship. We at least try to develop a little personal relationship in the short term. I know as a family physician, that is what makes the healthcare meaningful. I mean, it's nice to have the intellectual stimulation of a unusual diagnosis. It's nice to have the feeling of success of a therapy that works. But what really makes it meaningful is to put that in the context of a person and what that did for something that's important in their lives. You get the best chance to do that when you know people over time, when you live through different life events with people. But you can get a little bit of that even if you're doing one-off encounters with people. And it's worthwhile on both sides, for both sides of the equation, to try to invest in that, I